to improve the environment, they've actually done enormous harm to the environment. Yep.
I want to talk to you about Medicare Advantage program. I know it's kind of off the topics we've been talking about, but
That's okay.
I do some grassroots advocacy, and every year about this time, we await the budget from the Center for Medicaid Services, and every year it seems like they're trying to cut that program. And I'm wondering if that's on your radar at all, if you're familiar with the program.
Well, we can't cut. I mean, you're talking about Medicaid?
I'm talking about Medicare Advantage. It's basically
right. Okay.
Part C. It's kind of the
Right.
The HMO
Well,
choice.
again, that was changed in the Obamacare Act. I don't call it the ACA, the Affordable Care Act, because that's just false advertising. There's nothing affordable about it. But no, that was severely reduced in Obamacare, which is ironic since it's very popular, and it's the one part of Medicare that's actually working.
It really works, right?
Yeah.
40% of retired folks take that option,
Yeah.
and they get better care.
Yeah, and Medicare Advantage basically is you choose from a list of pre-negotiated plans, you choose the one that best meets your own needs, and then
Correct.
Medicare comes in and underwrites the cost of that. By the way, the Medicare Advantage is the model that we are using to try to get Medicare back on a sound financial footing before it runs out of money in 2030.
Terrific, right, because you have better outcomes, right? Medicare
Yep.
Advantage patients have better outcomes, and it costs less money.
Yeah,
So
and
it's
the
like a
reason is
win-win for everybody.
because they have the freedom to choose the plan that best meets their own needs.
And the plans a lot of times add in vision and dental,
Right.
so they don't have to go outside of it for that.
Exactly.
So we're going to be starting our big push and organizing our troops and trying to prevent these cuts to services.
You'll be hearing about a reform. Again, those cuts are already mandated. They are the law. They are happening.
Well, we changed it last year. They proposed big cuts in.
Well, a little bit, but the whole intent of Obamacare was to squelch Medicare Advantage, and it was written specifically. Well, one of the objectives it was specifically written to address. But you will be seeing that as the model for what we call premium support, which is move the entire Medicare system onto that kind of a structure where Medicare patients can choose from that list, long list of plans, find the one that best meets your own needs. If you want additional bells and whistles, you pay for them yourself, but the basic plans are for your selection, and then the Medicare comes in and underwrites the cost based upon how old you are, how sick you are, and how poor you are. It's just and it will save the system from collapsing. Final question. And by the way, we promised to be out at 7. I'm already kind of past
Actually,
that.
I had a follow-up. So the
Okay.
question is, can you support that idea then that we should maintain funding for a program that saves money for so many retired
Well,
folks?
yes. In fact, I would like to see the entire system modeled on Medicare Advantage.
Terrific. Thank you.
Yes, earlier you correctly mentioned that, by removing Saddam Hussein, we create a vacuum. And unfortunately, President Obama threw all the soldiers and handed it over to Iran.
Yep.
And now, these days they are on nuclear deal Iran, they did all the sanctions.